Welcome to Doc Talk with your host, Brent Lovett. And Doc Talk with Brent is sponsored by Battleborn Financial.
Hi, welcome to Doc Talk with Brent Levitt, and I am accompanied here today by Dr. Marianne Hazlett. Just to recap, we're actually interviewing wonderful primary care doctors and resources we have here in Pahrump. And again, I am Brent Levitt, your host, and I am the owner of Battleborn Financial Advisor and Health Insurance Brokerage here in Pahrump. And Dr. Hazlett is our wonderful primary care doctor with the Dr. Hazlett Medical Office. Before we broke for our commercial, we're going to talk a little about weight loss in this segment. And I actually made a mistake, and I said that it was a cash pay stuff. Actually, did you know that your health insurance will actually cover some of your weight loss programs? I don't know if you were like me, I gained a little bit of extra poundage during this whole COVID stuff. I think the depression and my 6 kids at home caused a little bit more of me wanting to eat a lot more just junk food and stuff like that. And the wonderful thing is sometimes it's hard to just diet and get it off on your own, especially when it's like, I don't want to be active. I can't go out and exercise because I'm stuck at home, locked away in my little house, and just want to like pull my hair out. As you can see, my hair is thinning a little bit more. But we want to make sure we do that. In Dr. Hazlett's office, talk a little more about your practice there and how you can help people with losing a little bit of weight and getting those pounds off, and how insurance covers it a little bit.
Well, if you come to see me, of course, and you have insurance is going to cover your visit, whether you're there for weight loss, or fatigue, for blood pressure, for anything that you come for, it's going to cover your visit. Also, we offer B12 injections for energy, and MIC, which is an amino acid injection, which helps with metabolism and appetite. And as long as you're coming in, you're seeing me, or you're seeing my nurse or nurse practitioner, you're having your vital signs, it's a visit, and you're getting an injection, they do cover injections. So you actually can get quite a few things that are covered. The only thing that's not covered is if we do have a few supplements for weight loss, but they're all relatively cheap anyway, which help enhance your weight loss. But following the diet that we give out, is a keto-based diet, you're going to lose weight. Men do very well. I mean, the men just have to read the diet and they lose weight. Women, we're a little bit slower. But that's the way it always is. Yeah. But the diet itself, you do great. It helps curb your appetite just when you get rid of carbohydrates. But coming in for a visit for that reason is covered by insurance. So it's a regular office visit. Some patients, though, they want nothing natural. They would rather do something like phentermine, which is an amphetamine, which kind of takes away your appetite. And we've seen incredible weight loss with that, because you basically just don't eat. There's some health risks, of course, with your heart, because it was the part of fen which didn't cause pulmonary hypertension or cause heart failure, but you still have some risks of being anxious, of having your heart rate a little bit higher. It's a great product, and some people want that. Insurance sometimes covers it, sometimes it doesn't, but it's about $15 a month. So
you can go on like GoodRx and you can get it really cheap, but I think it's like $12 even, like even on GoodRx. I think
right.
Pretty cool. And that's actually something people don't realize too. And, there's a lot of stuff out there that your insurance will cover, and it might be a little bit lower price, but some people forget that they always frustrated about the fact that, my insurance has all these prioritizations they put in my way. They have all this stuff. It's like, there are resources out there. People don't realize that, yes, insurance has blocks because you're using their money. They want to make sure that you're not going to be spending their money frivolously. Mm-hmm. But you're welcome to always, a lot of times, use your own money. And there are resources. We use a lot of times GoodRx just to make sure, am I getting the better deal? Because sometimes I'll find that some even pharmacies here in town, I'll have clients tell me, Brent, my copay with my plan, it says $25. And I went to this one retail pharmacy and they're like, oh, this medication is $25. Even though for a fact that prescription no way costs anybody $25, it costs them $4.
Yes.
You got to be careful with that too, because there's other pharmacies here in town that will still bill your insurance, but they'll give you that prescription at $4 or $5 because the cost of the prescription is a whole lot less than your copay is. And so it's interesting that some of them will do that. And I really hate that, because they just say, oh, it says 25, so I'm going to charge you 25. It isn't always the truth and how it works. And you can even get a lot of stuff, like Dr. Hazlett has a lot of medications and stuff where it's like, hey, we can sell it to you for a few dollars on cash, and you can get it here at the place, or we can help you out a little bit more.
Right. And I mean, another thing that we do is we offer testosterone to men, of course, and they do their injections, which usually is covered by insurance, and sometimes they don't like to give their own. They come in and they get their weekly injections at our clinic, which, if you have insurance, it's just part of your insurance without copay, so that's a good thing. But there's another interesting thing for men that they probably don't know. If you use your insurance and let's say you want to go on the blue pill, you want to do Viagra, you want to do Cialis, something like this, Some of those pills, they charge you $600 for 30 of them. If I put it in as a cash pay at certain pharmacies here in town, it's as low as $23 for 30 pills.
Wow.
So there's ways to get around that. And it's real, I'll tell, my patients, if your insurance is charging you, more than $25, $30 for this, just I'll put it in as a cash, and then just go to this particular pharmacy. They take the coupon code that I put in, and you can basically get your $600 prescription for nothing. So,
and weird little
it's a
tidbit.
big difference.
I don't know if you knew this either, but actually some of the Medicare plans, actually Humana on their new Gold Plus plan, you have to be on their new one.
Yes.
And also there's United Healthcare plan that also covers it too. You have to be on their Premier plan, but they cover the generic version of Viagra actually under their tier 1 and 2. Which is it's pretty cool.
I think
if you
it's
like
$30 or something. It's an incredible price.
And it's like you can get it, even the insurance will even cover it, which the insurance carriers don't actually have to cover Viagra or the generic of it, but it's one of those extra benefits they offer where they actually will cover it. Sexual wellness is very important. I know every doctor wants to make sure you do that, and it's something to talk about. You don't feel like, hey, I got to talk to Dr. Hazlett. She's a woman. I want to talk about, hey, I got a little problem, but she's a professional.
Yes.
So she's very good about that, and make sure that you see your primary care doctor and you can help get those things taken care of. Another aspect, I know we're on time, I want to think about is talking about weight loss. We talked about copays and insurance, all that fun stuff this year. And you also we talk about like skincare and dealing with our skin. I know for a fact, like I'm like an old white guy and we get like moles like crazy. And then like my wife too, it's like we've seen you actually for a few times for skin stuff, and it's been phenomenal because normally those are things you'd go see a dermatologist.
Right.
Now, your background, you said I believe you got your residency under a dermatologist.
No, I did internal medicine. I'm board certified in that, but I did an additional 6 months of training. So I did thousands of procedures before I ever left residency for skin cancer. So mainly doing biopsies, doing skin checks. About, when you do a skin check on someone, you look at their lesions, you're looking at different moles, you're looking at things called seborrheic keratosis, which are completely benign, but they're just not very attractive. You know almost right away what it is. Skin cancer has a very specific look, a very specific characteristics. You kind of know what they are, especially if they start to bleed when all you do is start to numb and it starts bleeding. You kind of know this isn't a good sign. And if you do have skin cancer, we do send you to a dermatologist for most surgery because it has to be done under a microscope so that they can actually continue to take out layers while they're looking to make sure they have all the cancer. But to do skin checks and to do biopsy, we do that liquid nitrogen. We do all that at the office. Yeah. And it's covered with your insurance, of course.
Yeah,
so
that's cool. I mean, it's really cool to think that you can see your primary care doctor and get some things done like your internal medicine doctor. A lot of people think that they have to see a specialist for everything. And they think that, oh, okay, I have a lesion on my skin, I need to go see a dermatologist. Oh, I need to go, I'm starting to feel really sad or something like that. My heart feels weird, I need to go see a cardiologist. And it's not always the case. I mean, your primary care doctor you're trained to see the whole picture and say, wait a minute, I can actually help with a lot of this stuff. I'm trained in a lot of these things.
Right.
I went to the same school these guys did. They just got extra training afterwards to help with their specialty care.
Well, there's the difference because I'm an internist, which is internal medicine. So we do a lot of diabetes, congestive heart failure. We do a lot of cardiology ourselves. We take care of a lot of different things. However, family practice does more children, even OB or women's health. They kind of take care, they say from the cradle to the grave is kind of their thing, where internal medicine is usually about age 16, and up. But we also have a nurse practitioner who does family practice. So she does a lot of our women's health, and she can also see kids age 12 and above. So we kind of expanded the practice in that way as well. So we could do some family medicine as well.
Yeah, so you have a 12-year-old kid in school and stuff like that, and you can even see Dr. Hazlett, see the same doctor, or see the same, not
Paula,
same doctor, but you can Paula, and see the same, and go to the same practice.
I see about 16 and above.
Yeah.
Yes.
So, and actually be able to get all your care at one place and not to worry about driving all over the place. And the other nice thing too is, I mean, it's a nice little family practice. If you ever get to go over there, right there on the, like I said, the corner of Homestead and 160, just right, little down the street from the Maverick station, you can go see. You see Dr. Hazlett's name, big bold letters there, and you can walk in. It's just family practice. You're not in a big building of just a bunch of other places and feeling like you're going to get sick. It's a very safe environment. In fact, your waiting room is actually kind of nice, and it's nice and cozy. You're not going to feel like I'm going to get COVID-19 from anybody else being in that office. We talked earlier in this segment about it's safe to go see your primary care doctor.
Yes.
And I think it's knowing that you're walking to an office and you're going to be treated like a regular human being and be seen and spend time with them, and they'll listen to you. And that's the biggest thing for me is like knowing that, hey, I can see a doctor here in town, get to see them and understand what's going on. Dr. Hazlett, you've been in practice. I mean, you've been in practice for how long? You've been doing this for internal medicine for?
Internal medicine, my whole career. So I went right from residency into internal medicine. I mean, right into internal medicine residency, and then became board certified. So, but hospital medicine is also part of that. So I trained mainly in the hospital ICUs, and then went into private practice when I was asked to open a clinic because of the need here in Pahrump.
Yeah. I mean, that's been great. And actually, I'll tell the story just because it's funny, but I cut my finger like just about a year. It's been a year now that I had this nice big gauge, and I went to the ER, and actually they sewed up my finger, and it was really bad.
It was really, really bad.
It was nasty. And Dr. Hazlett, luckily, she's like, yeah, we need to get you in to see you need to go back to the ER and get that seen because it does not look right. And sure enough, I went right got him into the hospital, and they do surgery on my finger and fix a bunch of stuff that just wasn't fixed in the emergency room. I think that comes, I mean, I don't know, not every doctor would see that and know what to do. I think your training helps a lot about that too.
When you worked in an ICU, I mean, you know who's sick, you know who needs to be in the hospital. I mean, immediately. If you come into my office and you tell me some things, or if I see some labs, we will send you right to the ER. We will get you right in because I've seen it. I know what kind of skin infection has to be treated. What, if something's bad, like your finger that blew up bright red. I'm like, that has to be opened. It has to be, you have to get the infection cut out of there. You need IV antibiotics. I mean, there's just no way around it. You can take all the pills you want, but you'll lose your finger.
Oh,
so
yeah. It was not fun.
it's nice to know about. It's nice to have that kind of training where you've been in. You've taken care of patients that are on ventilators and everything. So you already kind of have that experience. So you know when someone's sick and someone's not.
I think the biggest fear, at least for me and my family, is I don't want to go to the urgent care. I don't want to go to the ER because number one, you have to wait forever.
Yes.
And it's like, it's so frustrating. It's like, I just don't want to go to the doctor because I just feel like I'm taking away from everything else in my life. But the nice thing is you have same day appointments even sometimes.
We have walk-in. We keep several appointments open, so you can walk in and we can add a patient. If it's not for myself, Paula can see sick patients as well daily. So if somebody has to be seen, we can get you in the same day.
Yeah, I mean that's really awesome. Here again, I want you to make sure you have her phone number up if you can put that on there. I want you guys to call her office and get an appointment with her, get to know her and her staff. Paula is phenomenal as well. We have some wonderful primary care doctors here in town, and I want to get that. And if you want to get help with your health insurance, call my office. Battleborn Financial, we're here to help you. We're brokers, we do all the plans, and we will definitely take care of you in any way we can. Thanks so much for tuning in. Come back next week. We're going to do this again, and we'll talk even more and get more discussion. Thank you so much.